Hey guys, it's Dr. J here. Happy Friday. Look forward to digging in and answering some questions. How you all doing here? Live here on Facebook and YouTube. If you're enjoying these Q&As and these videos, give me a thumbs up, give me a like, smash that subscribe button, give me a share. Really appreciate it, y'all. All right, so let's dig in. So number one, I'm in the middle of my Thyroid Reset Summit, actually at the very end. So make sure you go to thyroidresetsummit.com and subscribe. Interviewed some amazing experts in the area of thyroid health. Today we had a nutritionist on. We talked a lot about postpartum and postpartum thyroid issues and how to overcome and how to boost back up your thyroid issue postpartum after a pregnancy. That's really really interesting topic. One of the biggest low-hanging fruits when it comes to autoimmunity slash Hashimoto's or autoimmune thyroid issues of any sort is an autoimmune template. I mean, that's huge. And one of the big things an autoimmune template that has to benefit the patient is the fact that it's very anti-inflammatory, right? It keeps out all the inflammatory foods, the gluten. It cuts out a lot of the lectins, right? From the nuts, the seeds, the grains, from the various nightshade foods, which can be a little bit inflammatory. They can be irritating on the gut lining as well. So these are low-hanging fruits that we really want to cut out to really reduce inflammation. So that was a big one. Also, digging deeper, gut health is so important when it comes to thyroid issues. There are lots of hormone experts that are out there that are just myopically focused on giving the right dose of hormones, and they forget how important the gut is because so much of the immune system is located in the gut, 80%, and so much of all the absorption of nutrition and nutrients that become the building block for our hormones, the building block for our neurotransmitters and our brain, all come from the gut. They all go into our mouth and we get absorbed and assimilated in the gut. So if we don't have good gut health, our ability to absorb, assimilate, utilize is going to be impaired. So that's really, really important when it comes to autoimmune issues. All right, so I'm going to dive in here, some questions. Writes in, I've been told that digestive enzymes do not work long-term and it causes our bodies to quit producing their own. That seemed to be the case with me. Your thoughts? No, it's not going to decrease your own production. It's going to give your body a break. I mean, one of the feedback loops for hydrochloric acid is a compound or a kind of hormone like peptide called gastrin. And gastrin, the feedback loop for gastrin does not decrease when you take digestive support. Acidity is a really important signal for activating enzymes, right? Activating pepsinogen to pepsin. It's a really important to have the acidity down to trigger our pancreas and our gallbladder release. So good acidity and good parasympathetic nervous system is essential. It will not. I mean, the question is, are you getting to the root cause of why you're needing digestive support, enzymes, and or acids to begin with? If we have an infection that's not addressed, well, that's going to be a concern. If we're still in kind of a state of adrenal dysfunction, a fight or flight adrenal state, and we're not getting into our parasympathetic state, well, that's going to prevent you from digesting optimally. Again, if you're constantly stressed, if you're constantly eating inflammatory foods, you're not giving yourself enough time to eat and digest, well, that's not the root cause, or you're not getting to the root cause, right? So if all those things are active, and then you're still taking enzymes and acids, yeah, you won't get to the root cause. But we're trying to focus on getting to the root cause. And using enzymes and acids, I think, is part of the biggest low-hanging fruit in functional medicine because we put so much focus on our diet. We can't just assume the foods that we're eating, we're actually absorbing, digesting, and assimilating. So we have to take those good digestive supports while we go through the 6R protocol. Remove the bad foods, replace enzymes, acids, repair the adrenals and or gut lining, hormones, adrenals, gut lining, remove the infection, repopulate, reinoculate probiotics, retest to make sure we're clear. So you got to get to the root cause of what is going on. Okay, cool. Next question. Same person. I've been on a low dose levothyroxine for 30 years due to enlarged thyroid to prevent further growth. Why would my thyroid be enlarged? Well, it's probably enlarged because your TSH went up. TSH is thyroid stimulating hormone. So if your TSH continues to go high, typically it's a sign of low thyroid hormone output. There's also a potential of low iodine in there as well. But the first thing is you got to get that TSH under control, ideally close to 1 or so. That's going to prevent, whipping the tired horse, so to speak. And then you can look at nutrient deficiencies down the road and also The biggie is autoimmunity. If there's uncontrolled thyroid antibodies present, that could be whipping and beating the crap out of your thyroid too. Got to look at all that stuff. Josh writes in, would having phantom smells of rotten garbage have a cause besides a brain tumor? I hope so. I'm not sure. I need to know a little bit more context of it. It could just be there's a significant putrefaction of food in your tummy and your digestive tract, and you're just smelling a lot of that rotting that's coming from inside of you because of poor digestion. So I would lean on that first. And then the next thing is there could be infections, and then writes it, there could be infections going on in your nasal cavity, right? In your sinuses, bacterial or fungal based. You can get what's called the nasaline, and then you can get the Nettie's Lear, or you can get the Neomed rinses, and then you can use the nasaline and use that component, mix it up and inject it in to help clear out any debris that could also be in your nose. And if you go to my site, justinhealth.com/shop, and go to recommended products, I have a whole bunch of just links to Amazon products that I don't provide that are on Amazon that you can get. Hey, Elmo, hope you're doing good. Heidi Lee writes in, what's the best thing to do to get my hair to grow back after an H. pylori infection? Well, make sure you're taking hydrochloric acid, and make sure you're taking some enzymes. Make sure you're eating good quality protein. Make sure you add good quality collagen peptides in there, probably 40 grams a day, 30 to 40 a day. Also, make sure there's no issue with your thyroid as well. But if you do that, that's going to give you a great chance for your hair to grow back. Okay. Joanne writes in, when's the best time of month to take a saliva test for the adrenals? Well, I mean, I would typically just choose a normal day of stress, not a weekend day, not when you're kicking up and you're relaxing and you're on vacation, but a normal day of stress. Now, if we're combining it with a female hormone panel and you're a cycling female, then we want to do it right in the heart of your luteal phase, right around day 20 to 22 or so, to get a window of your progesterone spike as well. Okay, hope that helps there, Joanne. Monica writes in, good to see you, Dr. J. Do you think tingling in the hand is a candida symptom? Depends. If it's positional, where you're sitting in a certain space and then moving around helps it get better, there could be, depending on where. If it's the pinky, that's C8. If it's the middle finger, that's C7, right? Middle finger, C7. Index and thumb is C6. And then up here by the top part of the deltoid is C5. And then up here is T1 and T2. So those are the nerve roots. If it's bilateral, then it's coming from the spinal cord. If it's on one side, then you would just look at whatever space up. What do you look at? Whatever peripheral lesion in the muscle. There's probably scar tissue or some type of trigger point adhesion that's preventing that nerve from moving. So you got to get to the root cause. If not, if it's systemic and there's not a spinal cord issue, then we look at B vitamins, peripheral neuropathy, B vitamins, insulin resistance, all those good things. Kitty writes in, 4 months of high dose antiparasitic antibacterials, and I feel like crap. Okay. So make sure, so number one, 4 months is a long time. Typically I only go 2 to 3 months, depending on what came back. You have to make sure the diet's in play. You have to make sure the hormones, the adrenals, and the nutrients are all dialed in first. That's super, super important when you're doing a higher dose kind of parasitic program. It can be a lot of inflammation released when you're killing all these dead debris, right? These parasites have lots of lipopolysaccharides from the bacteria. They can have mycotoxins. They can have all these dead debris that your liver and your lymphatics and your immune system has to process. So low-hanging fruit is you can take activated charcoal away from food and supplements to help bind it up. It kind of like puts a straitjacket on it. Number two, you can also juice some ginger. You can take 2 or 3 ginger pieces. You could add about 12 ounces of hot water. 12 ounces of hot water, and then you can add a little bit of honey and lime in there, and then it makes about 16 ounces, and you can sip it throughout the day. That can be super, super helpful, and that kind of helps the lymphatic move. So I would make sure that those are in place first, and maybe go back to the basics with the adrenals and or diet stuff first. Allison writes in, if FODMAPs are an issue, how long after limiting high FODMAP food should I start to feel better? Typically within a week, you should start to feel better after cutting out FODMAPs. FODMAPs are fermentable carbohydrates. So if you have SIBO or bacterial overgrowth, these fermentable carbohydrates will cause bloating. They will cause gas. They will cause digestive issues. So if pulling them out reduces the bloating or the gas, that's a good sign. And then we want to add them back in after you kind of plateaued. And we start with moderate FODMAP foods first. That could be like avocados. It could be sweet potatoes, broccoli heads, those kind of things first, and see how we do. Do a smaller amount as you increase it each day over 2 or 3 days. Make sure you add in some hydrochloric acid and enzymes too. Let me jump over here to Facebook. Kevin writes in, Dr. J, can you tell me if your stomach acid is low? How can you tell? Can the symptoms of low stomach acid be silent? Well, number one, if you have poor digestion, if you have bloating or gas, if you're not regular digestive wise, if you see a lot of food particles in your stool, that's a good indication that stomach acid's low. It's just a natural sign of aging, right? In Dr. Jonathan Wright's book, he talks about why you need stomach acid. And he just has a graph of age and stomach acid dropping. So just keep an eye on, just as you get older, if you're having poor digestion, if you're not regular, if you see particles, food particles in your stool, this is all a good sign that you may not have enough stomach acid. And I consider stomach acid and or enzymes is the low-hanging fruit in functional medicine, because it allows you to grab more nutrition from your food. That's huge. That's really huge, because we invest so much money in good food. We want to be able to digest it and assimilate it and absorb it. Just because you're eating it does not mean we're going to be able to get it in our bloodstream and utilize it. Let me keep on writing here. Dr. J, what's the picture frame to your left? Looks like a cartoon. Oh, yeah, this is a great one here. This is the poopy policeman. So when I had a physical office, we'd review how your stool would look. So again, this guy right here, see here, this guy's the pellet guy. So this is more of a constipation person right here. This is a looser stool. So this is faster transit time, lots of protein powders. This one right here is just poor bile acid, not enough HCl and enzymes. Same with this guy too. See the more clay color there? Just not enough acids, not enough bile salts. This one's like a lot of toxins, alcohol, pharmaceutical drugs. And this is your poopy policeman. This is how we want it to look. 6 to 12, 12 inches of stool a day. You can do 1 12er, you can do 2 6ers at least is good. And we want to see, a number 4 on a Bristol, which is like the poopy policeman right here. Okay. This is kind of a cartoon version of the Bristol stool chart. Good observation there. J. Pat writes in, what do you do for health insurance, HSA? Is there an insurance with a high deductible in case of emergencies from major surgery? You don't want to spend a lot of money each month for insurance we're not using. Yeah. So personally, anything from me, we super bill code it so it goes off your deductible. Number 2, we use Medishare, which is like a Christian-based healthcare thing, and it's like, I think we pay for my family, it's $425 a month, and it gives us $1 million of coverage, and the deductible is $3,500, and then we have $7,000 of HSA money. So we pretty much use everything for HSA, and then use the high deductible, or then use the actual $1 million coverage stuff for like traumas or an accident, something like that. So that's kind of how we do it. That way it gives me maximal HSA money for supplementation or, things that are more natural and root cause based, if you will. Let's see here. Akimel writes in, after GI Clear 1, 4, and 5, I became intolerant to safe starches and many other foods. Would GI Clear 3 and Para 1 exacerbate and make me more intolerant to foods? So it depends. You could just be in the middle of killing things. Did this happen in the middle of using some of the clearing herbs or at the end? So timing is really important. Dr. J, what did your last GI map show? I got to rerun it. I got an ion panel, I got an adrenal test, and I got a stool test I got to run very soon here. So I'll be doing that before the year's up, and I'll do a podcast on that. Irma writes in, any remedies for globe sensation with gallbladder disease and SIBO? What's globe sensation? Let me know. I've not heard of that before. I probably know it just as something, a different name. Let's see here. Globe sensation is, it's a functional esophageal disorder characterized by a sensation or lump in the throat. So number 1, it could be a thyroid issue. It could be an autoimmune thyroid issue. It could just be poor indigestion from stomach acid issues, H. pylori, gut inflammation. So it just depends on what the root cause is. Jakob writes in, do you have a free consultation? My office does them. We have a nutritionist that will go through it. I don't do them anymore. I'm just too busy, but we still offer that. justinhealth.com/free-consult. It's me writes in, any solution for endometriosis? Yeah, lots. Get to the root underlying cause of why there's estrogen dominance. Estrogen dominance is what drives endometriosis. Estrogen dominance is where your relationship to estrogen to progesterone is skewed. Normally you have this 23 to 25 to kind of 1 progesterone to estrogen. And as estrogen starts to creep up, or as progesterone goes down, and sometimes it's both, it's progesterone going down and estrogen going up, that can drive endometriosis. So we got to get to the root cause of that. Typically, we'll do high systemic-based enzymes away from food to help break down that tissue as well, but you got to get to the underlying issue. Kristen Andrews writes in, How can I figure out why I'm losing hair? I have hypothyroidism, but my TSH is at a normal 1.6. Yeah, that's a small part of the equation. How do all your other thyroid numbers look? T4 free, T3 free, T3 total, T4 total. How do your antibodies look? Any reverse T3? So you really only have a small piece of the picture there, Kristen. And again, if you've gone to your conventional doc or your endo, I wouldn't be surprised because that's all they tend to focus on. So you need to get a bigger piece of the picture on why that's happening. And also you need to look deeper at your digestion because all the building blocks for your hair, they all come from you being able to digest and absorb things. Bridget writes in, my son has some red spotting in his bowel movements. He has colonoscopy scheduled, not found. Any thoughts? Is still eating dairy, was checked for celiac, but came out negative. Thanks, Dr. J. All right, Bridget. So off the bat, I mean, you can work on getting him on a paleo template or an autoimmune paleo to start. Number two, does he have a history of hemorrhoids? The first thing it could be is just hemorrhoid issue, and some of the blood's coming out from the inflamed hemorrhoids. If it's not a hemorrhoid issue, I mean, there could be some blood in this, an ulcer in the stomach area, or there could be ulceration somewhere in the intestinal tract. On some of the stool tests that I run, they'll look at fecal occult blood and they'll kind of rate it on a scale of like 1. I think anything above 10 is positive. So you can kind of get a rating with some of the tests that I use. But you have to get to the root cause. So the first thing is the foods, and the second thing is the infections, and the third is making sure you can digest the foods. But I would get your kid at least on a intro level GAPS or SCD specific carbohydrate diet to start. Okay, here. Did I get everything here on Facebook? Yeah. All right. Alex writes in, doctor, if I have apple cider vinegar with my raw fermented food, would that kill good bacteria in my gut? No, your stomach's naturally about a pH of 1.5 to 2.5. So that is pretty darn normal. Another question here. Design Lover writes in, where do we find a FODMAP diet food list? In my members area, if you're a patient, you can find it. If you have an iPhone, you can download the app by Monash University, Monash. You can also get one called FODMAP A to Z. That's a good one. Those are some good ones that you can look at. Immortal PUBG writes in, thoughts on 100% pure gum spirits turpentine for parasites and candida. I've heard some interesting things about it, but I don't have any direct experience with it, so I can't give you any direct feedback. Who is here on a gluten-free diet? I mean, I'm on a grain-free kind of paleo diet. Probably most people are. Patty, but if you have any questions on that, Yakov, let me know. Patty Moran writes in, I've been itching on my torso the last month. I think I have an issue with histamine, looked up histamine causing foods, tried to reduce these. Any thoughts? So yeah, so off the bat, how did you do, Patty, reducing the histamines? Did you feel like there was less itchiness? Did you cut out fermented foods? Did you cut out citrus? Did you cut out aged meats? How did you do with that? If it helped, that's a good sign. I'd also urge you to kind of go on a paleo template. I'd also urge you to work on digesting your foods better with enzymes and acids. See if that helps. And then you'd want to dig in deeper later on, looking at hormones and gut. Jeff writes in, hey, Jeff, how you doing? Would it be all right if I took some serrapeptidase to help with my scar tissue in my stomach from the H. pylori? Yeah, it could be really helpful. I got a whole bunch of enzymes coming here today, and I'm going to be just doing just a cleanse. I do a quarter, once, at least for a quarter, once a year, I do a high dose enzyme cleanse just to clean my body out, clean out scar tissue, clean out inflammation, just to kind of give me a gentle, cleanse all the arteries, right? Open everything up. Let me go switch back here to Facebook. Layla writes in, I've done inflammation tests that showed I was negative. My Cyrex Array 7 showed antibodies to all brain tissues tested, lots of neurological symptoms, restless leg, PLMD, not sure what PLMD stands for, essential tremor, Cyrex Array 2, leaky gut came back negative, fibrocystic breast, cystic ovaries, Hashimoto, 7mm Chiari malformation, total loss of where to look now. I'm doing AIP with little luck. Yeah, that's tough. You got a lot of stuff going on there, Layla. You really got to hook up with a good functional medicine doc to go deeper. But I mean, we start like kind of intro, diet and lifestyle, digestion. Then we want to look at the hormones. Then we want to look at the gut. I keep it really simple because most doctors imagine a tree. You have the branches or you have the individual leaves of the tree. Those are all the individual symptoms. If you focus on each individual leaf, there's a lot of things to focus on, and it kind of makes your head spin. I focus on the limbs and the branches because the branches and the limbs emanate to lots of different leaves. So it gives us the best bang for the buck to work on the core underlying things that emanate out to the smaller, more minutia. But that's just really, you got to dig deep and look at the gut. You got to look deep and look at the hormones, and you got to get the diet and the digestion going first before we really worry too much about anything else. Let me keep on rolling back here. Lost my spot. Sean Ryan writes in, what does it mean if you have pellet poop? What do you recommend? Yeah, typically pellet poop it's more on the constipated side. You can improve fiber. You can improve hydration, more water consumption, and obviously up enzymes and acids to help. Akimo writes in, food intolerance to safe starches and other AIP foods started after finishing GI Clear 1, 4, and 5. Well, did you add in probiotics next? How did you do with the probiotics? And if it happened right after that, we may want to go on the herbs a little bit longer and retest. So there's a lot of things, a lot of extra things we got to look at next. And again, I'm not sure, I don't have access to your name, and it'd be a HIPAA to talk about your situation, but we'd have to dig in deeper as well. How to improve upper digestion with a gastric ulcer, short bowel syndrome, reacting to HCl and bile? It's a great question. So how do they know you have a short bowel syndrome? I mean, my whole thing with that is, unless you had your bowel resected, obviously it's shorter. If it's just shorter because of inflammation and retraction and scar tissue, well, then we got to get all the inflammation out via your diet, get some healing, soothing support there. And if we can't do HCl or bile salts, we got to work on proteolytic, amylolytic, lipolytic enzymes and some Swedish bitters to start. That's what I would do. Alamo writes in, is it possible to overcome nickel allergies? Yeah, get your body healthier, get it less inflamed. You're welcome, Bridget. You're welcome, Design Lover. Paula Hearn writes in, I was just diagnosed with Crohn's. How does that change your protocol compared to a typical, more healthy patient? It depends. Definitely start with an autoimmune kind of SCD template. Really have to work on being able to digest the food. There's so much inflammation with patients that have Crohn's. So we really got to get everything dialed in with the food, not only the food, but cooking it well, making it easier to digest and absorb and assimilate. Work on enzymes, don't go too high on the acids because it may irritate the gut. Lots of healing and soothing nutrients, and then get a window on what's going on from an infection standpoint. That could be an issue. Layla writes in, yeah, you have a functional medicine doctor, but she's lost too. Yeah, so I would regroup. Feel free and go to my site, justinhealth.com. You can schedule a consult with me. We can dig in deeper and review those labs and figure out where the next place to go is. But key thing is inflammation, leaky gut. We got to go after what the infections are. We got to go support your hormones. Start at the foundations, right? Don't go into the leaves. Start at the branches and the limbs. Foundations first. System-based approach, not symptom-based approach. All right. And again, I'm not a big fan of a lot of the Cyrex tests because, okay, so you got all these antibodies. Now what? That's the effect, not the cause. So I try to do testing that looks at the cause. If we hit the cause, the effects take care of themselves. But if you just test all the effects, well, what do you do now? You just have a whole bunch of data that now you kind of feel a little bit paralyzed and overwhelmed with now. Jack JMC writes in, is turpentine castor oil good to kill parasites and infections and bacterial overgrowth? I've heard some stuff about diluted turpentine. Castor oil is more on the constipation side, but it's hard to say. Layla writes in, leaky gut's fine. Hard to say if leaky gut's fine. If you're just basing it off of that Cyrex panel where they look at occludin and zonulin and actomycin, those kind of markers, I mean, I go and look at the actual things that are causing the inflammation. I just assume leaky gut if I see stressors there. I don't need those other little markers to tell me because I go after the actual root underlying issue. So go after the root stuff. Don't go after the end stream data. Go after the causal data. Colin Farrell writes in, Colin, where'd you go? Any experience using venopectin for brain fog? Yeah, that's I think it's a bioflavonoid or kind of like in that same family as like grapeseed or like resveratrol kind of family, which is good for inflammation, good for cognitive brain recovery. With brain fog, I mean, I've had good experience with those types of family. It just depends on what the root cause is. If you're taking venopectin but still have a crappy diet, then it may not help that much. So you'd want to make sure you get to the root cause. But yeah, those type of bioflavonoids do show some neuroprotective results. Patty writes in, Cut out all those foods on HCL, eat clean keto diet, maybe 10% better with itching. Good. So we got to do some testing on the gut then to look deeper. Monica, symptoms of Epstein-Barr. Well, the big one's going to be kind of fatigue, malaise. That's going to be a big one. And there's some testing you can do with Epstein-Barr. I use a lab out of New Jersey called Medical Diagnostic Laboratories. We test EBV, early antigen, nuclear antigen, and viral capsid antigen. And we do IgM and IgG. J. Pat writes in, been taking GIAClear 145 for a month. Symptoms not worse or better for dysbiosis. Are there symptoms to look for to know if it's working? I mean, ideally, you don't want a whole bunch of negative symptoms. That's good. If you want to increase the potency, add in some of the ginger tea that will help with biofilms, which are like the protective shields a lot of these critters use to protect themselves. So do that. And then when we chat at your next consult, we can talk about, where you're at with everything. Jeff writes in, thank you for your help because my dad had hep C and liver cirrhosis. And the doc said there was no way to heal. I'm glad scar tissue can heal. Yeah, it definitely can heal. Again, if you got to get to the underlying issue, right? If liver cirrhosis is caused by, let's just, I'm making this up, but let's say alcohol, right? Well, you can't continue to drink alcohol, take the enzymes and expect to have a good effect. But, with the liver cirrhosis, I'd also put milk thistle on there and some glutathione and some dandelion. Some of that's in my Liver Supreme product. There's some good anti-inflammatory, good liver supporting herbs in there, and I'd also add in the enzymes as well. But big liver stress is going to be sugar and fructose. That's the big liver stress. Design Lover, thoughts on grass-fed beef organ supplements versus grass-fed beef specific organ supplements, i.e. liver spleen for borderline anemia, Schomburg's, keratosis, pilaris. Yeah, I mean, I think just a good general organ support I think is great. If you have a targeted organ deficiency, obviously taking specific organ tissue is going to help because there's certain nutrients in a liver that's specific to a liver functioning well. So if you have a specific issue, you can take a targeted organ. If you don't, then I think just a broad spectrum one is fine. Colin writes in, anything for brutal CFS, that's chronic fatigue syndrome. It doesn't seem to let up. Diet consistent, very strictly of meat, dark leafy greens, good fatty acids, past 12 months, no decrease. So got to look at thyroid, got to look at adrenals, got to look at mitochondria. I tend to find a flogged mitochondria when we look at it. And we'll see it via organic acids or an ion panel. And a lot of those, nutrients for the mitochondria are low. That's CoQ10, B vitamins, ALA. PQQ can also be very helpful. Make sure the gut's working too. CFS, chronic fatigue, typically does not happen in isolation. Bridget writes in, any suggestions for before and after doing a colonoscopy for my son? I mean, I would typically not do a colonoscopy. The only reason I would is if he's bleeding or there's some kind of thought that there could be a cancer. If there's just some gut issues, gut symptoms, I would be looking at more of the functional testing before I did a colonoscopy. So it just depends why you're doing it. If you're trying to rule out a cancer or an ulcer, fine. But if it's something more in between and it's not life-threatening to do it, I would look more at functionally first. Okay. But again, I can't give you health advice virtually like this without more data, but just kind of follow that generally speaking. J. Pat writes in, what MCT oil do you use in your coffee? Thanks. I use two different brands. I use the Jarro's one because it's just pure coconut. I get loose stools if I do MCT with palm in it. So I do only the pure MCT from coconut. Akimo writes in, can we start with probiotics without being sure of SIBO being clear through testing? Yeah, we can start with it. That's fine. A lot of these good probiotics will have some antibacterial effects anyway. Alex writes in, doctor, I'm at my last meal at 6 p.m. and I wake up around 1 a.m. having a hard time sleeping. After, what do you recommend? What time do you go to bed? If you go on to bed at 10, that may be 4 hours from 6. There could be some blood sugar issues. So I try to have something within an hour before bed to make sure blood sugar is not an issue. It could be. And if it is, I'd also have maybe a smoothie sitting right on your nightstand. So if you wake up, you can hit that smoothie. If it's a blood sugar issue, you'll start to see some benefit with that. Patty Moran, you're welcome. J. Pat, my son had ADHD. Any natural supplements you'd recommend for focus and hyperactivity? Well, first, make sure the diet's dialed in. Paleo template, no refined sugar, no grains. Keep the fruit to the lower sugar stuff. That's the first. And then after that, I mean, the easy thing is going to be B vitamins, amino acids, and or, I mean, it just depends on how old your kid is too and how much stress. But I would probably do something like an adaptogen, like an ashwagandha. I do some B vitamins, and I'd probably do something like some tyrosine. That'd be helpful. Monica writes in, what's the best way to take HCl and enzymes? I have a whole article on this. Go to my website, justinhealth.com. Google that. I have a video and an article on it, but take it in the middle of your meal. Start at 1 on the HCl, work up to 5 or 6 caps. Any warmness or burning, back off by 1. Enzymes typically no more than 3 caps or so. Akimo writes in, how would you know if their gut has cancer for someone who has been sick for 20 years? Well, I mean, typically, if you're going to have some kind of gastric cancer, one, you're going to have massive weight loss. You're probably going to see blood in your stool. You'll see a lot of malabsorption. So a lot of that will probably be seen on a lot of blood work ahead of time, and you'll have all those clinical symptoms first. If you don't have those clinical symptoms, then you should lean into more of the functional testing first. All right. But usually doctors, like conventional doctors, are pretty good at picking up those kind of like obtuse kind of acute things. It's more the in-between stuff they don't do a good job at. And people can deal with the in-between symptoms for decades. That's the problem. All right. Bridget, you're welcome. Appleface writes in, what probiotics do you recommend? So in my line, I have a ProBioFlora that's a broad spectrum bifidolactobacillus. It's got some FOS in it, which is like fertilizer to help the good bacteria grow. I do high-dose Saccharomyces as well, which I like for IgA and yeast issues. And then I'll do a spore biotic as well, which is great for people that are more sensitive, and it really helps potentiate the growth of, a lot of the good bacteria in the gut. So I like those off the bat. There's a couple outs that are out there. I mean, there's Primal Defense Ultra by Garden of Life. There's Prescript Assist. They changed that formula recently, though. So those are a couple of good ones. There's obviously your more mainstream VSL3 as well. Elmo writes in, I wake up suddenly after sleeping just a few minutes and I feel panicky. Yeah, it could be a blood sugar thing. Could be an adrenal thing. It depends. You skipped a meal. You haven't eaten in a while. That could be a problem. Flea Bob writes in, any recommendations for a low histamine paleo breakfast? Yeah, I mean, you could just do some meat that's not like, not like a meat like a bacon or like a sausage that's like has a bunch of preservatives in it, but just kind of fresher meat. Or you can just do a collagen smoothie, something like that. And you could do some fruit that's, lower on the histamine side, and then maybe some coconut milk. That's an easy smoothie breakfast. Okay. You could always do some eggs, some coconut oil. That's an easy one too. That should be on the lower histamine side. What do you suggest for panic attacks with agoraphobia? So I think agoraphobia is the one where you're having a hard time being out in public, right? I mean, I'd look at the adrenals. I'd look at the neurotransmitters. Again, what kind of protocol? I'd want to know what your pattern is first. It's a little bit more intricate than just saying, hey, take this. But of course, the diet is my starting point for everything. Let me give you guys a little Facebook love here. Hold on. A couple questions in the queue. Ryan writes in, hey, Ryan, hope you're doing good. Any chance you have a link to the most common tests you do for yeast, bacteria, and parasite infections? Thanks either way. Hope you have a great weekend. Thanks, Ryan. Yeah, go to my site and go into the shop, justinhealth.com/shop, and look at the DSLGI map test. There's a white paper up there. There's some newer stuff on that test now. They're looking at even more stuff. But you can look at the white paper first and see how that looks off the bat. All right. Outside of that, let me just keep on rolling here. Any other questions? Design Lever writes in, any hope, recommendation, plan of action for patient with recent colostomy bag, stage 4, colon cancer. Doc wants to stop chemo, giving morphine pills. That's tough. I mean, number one, I would look at a GAPS or an SED type of template. I mean, you may even want to go to an elemental diet, really, because when you have that much inflammation, it's just so hard to absorb nutrition. So I would go with a really good elemental diet with all the nutrients in there, everything really easy to digest. I'd work with that first. And then you really have to work with a good natural cancer doc. I mean, you could do some higher dose enzymes to help, but I can't go into specifics. It's too intricate, but I would work on a good quality elemental diet to help while the gut heals from the surgery. It's just a little bit too much detail here to do on a YouTube live. J Pat, you're welcome. All right, guys, I think we hit everything here today. Let me just make sure no other quick questions. Jack writes in 816 fasting for 8 months, breaking my fast with bone broth protein smoothie. Lately, okay. I'm experiencing stomach cramps soon after. The only thing I recently added was enzymes. Deleted them. My cramps seem to be gone. Can enzymes sometimes be the cause of stomach issues? Well, it depends. I mean, if you're not doing it with solid food, if you're doing it with solid food, you may not need it, right? The bone broth may already be broken down enough where it is okay and you don't need that. Okay. All right, guys. Hope you all as well. I got to jump on here. I got a patient coming up here soon. You guys have a phenomenal Friday. And I look forward to coming back on Monday with a fresh podcast. Like, thumbs up, give me a share. Appreciate the love. You guys have a great weekend. Take care. Bye.